Welcome to Healthcare IT Today. I'm Lynn, together with my special guest host, Scott Overholt. The world of technology and healthcare are ever-changing in new and novel ways, and that's why we love this stuff. So join us as we discuss the latest healthcare and health IT news, meshed together in new ways, which help generate ideas and new perspectives. Plus, we'll be having a little fun along the way. Today, we're going to be talking about eliminating manual work. Today's episode is sponsored by Vine Medical. For over 25 years, they've been trusted nationwide as a leading healthcare workflow tool. Learn more about Vine Medical's customizable suite of products at Vine Medical. That's VYNE medical.com. And be sure to follow the show on social media at the hashtag HITSM and my personal account at TechGuy and the Vine Medical account at Vine Medical, VYNE medical. Plus, check out our 18 years of health IT blog content at healthcareittoday.com. Welcome, Scott. We've known each other for a long time. It's great to have you on the show.
Thank you, John. Great to see you.
Yeah, and it's funny, eliminating manual work. Does anyone like manual work?
Exactly. I don't think so, especially the kind of manual work we're talking about in healthcare.
Well, there's so much manual work in healthcare, right?
There is.
Talk to me about what do you think is the state of the administrative office, where I think most of the manual work is in healthcare today?
Yeah, it's interesting. There are, if you look at the volume of information that's coming into the hospital that requires human touch, it is truly massive. Mm-hmm. It includes electronic documents, PDFs, faxes. So there are electronic images, basically, that are coming into the health system that have no structure. And so a human with this manual work has to identify the document, has to transcribe, has to index, has to notify, has to push it to the EMR. And that's just one example. There are plenty others.
I mean, to me, when I think about that, I'm like, it's kind of part of the legacy of healthcare. Because where did we start? We started with a bunch of humans pushing paper into charts and organizing them into charts and creating different color coding for how to get through the chart and how to do it. And so the mentality of healthcare was use humans to organize the data for the doctors and nurses who needed it. And so, to me, in many ways, what I think we're doing in healthcare almost feels like a legacy of that lack of automation and using humans instead of technology, which, to be fair, at the time, there probably wasn't the technology available. So, I can't blame healthcare in some ways because it was very human-focused, and it's true with doctors and nurses. It's a very human-focused profession as well. So I wonder, is that the challenge? Part of the challenge is it's a cultural thing that we use humans instead of technology.
Yeah, agree. Interesting point is that NAHAM, National Association of Healthcare Access Managers, just had their 50th anniversary event.
Wow.
And as a part of that, the organization took a look back 50 years ago at what the patient access department looked like back then. And
that's eye-opening, I bet.
Yeah, you're talking all paper, a lot of handwriting, some typing, et cetera. So it is very legacy, the way that these systems are built.
Well, and I think you look at it and you think, well, how do we solve this? I think technology is one solution, but I also think when I think about the organizations I've talked to, they can't hire enough people. So people can't be the solution going forward. It has to be some use of technology or streamlining the workflow or the process. There's just not enough people that want to do those jobs. And I'm with them. If I was graduating college, I don't want to go do a bunch of manual tasks that aren't that fun and not that exciting. I think about Zappos in Las Vegas. Mm-hmm. Why did they move to Las Vegas? Because Zappos is really a big freaking call center. And then they have 100 programmers who do a website, right? Mm. To buy shoes. But they're really a big call center. So it's a bunch of manual process. So he's like, how do I hire a bunch of call center people? He said it's all about culture. So he created this culture of fun and exciting and team, and we're hanging out at night and we're going, we're friends. It's almost like a family, because he realized something. Nobody wants to be a call center agent. He's like, so he had to be creative to do that. And I think that's the problem in healthcare. But we can't, maybe we could learn something from Zappos, but like there's just not enough people that want to do those tasks.
That's very true. I mean, if you look at employees' alternatives for, call it $20 an hour, I mean, you can basically transcribe an electronic image into another system all day long, or you can go, flip burgers or do whatever.
I was going to say, my daughter makes more than that at the coffee shop.
Exactly. So it's there, it's not a very appealing job for most people, for sure. There is a phenomenal opportunity for workflow improvement and also for automation in these processes.
Yeah. So, I mean, let's expand the conversation. Okay, we have a problem. There's a lot of administrative tasks. We don't have enough people. As I look at it, what's, and the key to kind of streamlining the administrative office? For me, the first step is finding good technologies that are trusted. Is it HIPAA compliant? Is it secure? And does it solve the complexity of healthcare? Because I think a lot of these, I just had a form vendor send me a pitch and said, hey, we want to help healthcare in this. And I'm like, do you understand the real problem? Because obviously you don't. And so to me, that's like the first step of streamline is making sure that it's someone who understands the complexity of healthcare and the needs of healthcare. What would you add as far as streamlining the administrative office?
Yeah, so the keys are providing workflow tools that take those manual tasks and make them simpler, and then even potentially automating that. But a real key is the integration, right? Because there are so many systems, healthcare is so very complex that if there's not integration with other systems, it just leads to another manual push or a manual exchange. So being highly interoperable and integrated is critical in healthcare.
Yeah. I think the challenge too is like, there's so many things that need to be done that if I'm a healthcare provider organization, I'm like, where do I start? We've seen some interesting benchmarking tools at HFMA where we're recording this. Like, I think that's an interesting way to say, okay, I should have been taking advantage of these opportunities and I haven't. I look, we're going to talk about some faxes later, right? I think in this, I think that's an interesting place to streamline the workflow. I think you look at small balance collections on the RCM side of things, really interesting. Like, humans shouldn't go after small balances. They're literally small for a reason. And so, I look at that and it's like, no, that needs technology and the automation to do it. Where are you seeing kind of people applying technology in this way? Are there some sweet spots with your customers that you're like, yeah, we've been able to do this, this, and this for them, and it's really made a difference?
Yeah, it's a great question, and there's a number of them. If you study workflow in healthcare, you'll see a lot of document identification, a lot of transcription, a lot of indexing these records to the patient, a lot of notifications to other departments and other people, and of course, a lot of pushing all of this to the EMR. But if you dig a little deeper, there's others. There's things like forms. So state Medicaid departments, et cetera, they have forms that have to be that
which is usually a paper process.
It's a paper process, and it may be that they're able to type the data in, but the data is not integrated. So it's literally someone typing out a form. It can take them, 10 minutes to do. So that's another example of this manual work we're talking about. Another one is you've probably seen as hospitals consolidate and create centralized operations. You've probably seen rooms or floors with hundreds of people that do nothing but, do this transcription work and talk on the phone. Well, the phone communication, the verbal communication is so critical in the patient experience and downstream workflow in a lot of different areas. Managers, I've asked this question of a lot of managers before. Managers of those 100 people out there. How do you manage the quality of the communication? And every single time they'll say, well, we take a sampling and we do a manual scorecard, right,
Wow.
to evaluate, how our agents are doing. And if we find red flags, we'll talk to them about that. All of those things that we just mentioned the workflow can be vastly improved, and the majority of it can be automated.
Yeah. It's interesting. I wonder how many even realize that's possible.
It's true.
Like it's probably not for ignorant. I mean, a little bit of ignorance of not knowing these solutions are out there. And to be fair, I remember a CIO telling me this one time. He said we're so overwhelmed with the minutia of the operations that we don't have time to explore those types of solutions, which I think is a big problem. I will say there's been amazing solutions out there, though. Like the coolest one I saw that was so fascinating as far as automating these, administrative workflows and these mundane tasks. Someone built an entire bot to call the insurance company because they were calling all the time to get information about eligibility. I can't even remember what it was for. And it was literally an automated task. Hey, I'm calling for Scott. Here's his number. Here's his birth date, all this. And then they give them the info. And they created a bot to literally call the company to do it. I was like, this is embarrassing that we need to do this, but what a cool solution.
Yeah, exactly. It's an interesting point. That's how our company was founded.
Oh, really?
Was automating calls to insurance companies. Now, this is 25 years ago.
Okay.
But back in the day, it was all, a manual call that had to happen and a big hold time. And the hold time was the problem. And once they did connect, they would limit the number of transactions they could do. So they had to call right back and get in the queue. And it wasn't called a bot back in the day, but it basically automated the phone call and the outreach to the payer, collected their information, brought it back. So very similar.
It's so interesting, right? And that bot will wait on hold as long as they want. You and I would, we just don't put any sharp objects near me. I might do something I regret, right? Like, because, we hate this, right? We don't like the manual work. So I think that's really interesting. But I think what's cool is the technologies are here now to automate that. And I think maybe that's an important message from this discussion is that you don't have to suffer anymore.
No, it's true. If you do the math, if you just do the math on what it takes for a hospital to process 1 million documents a year, 1 million documents with an average, and this is a pretty good average of 3.5 minutes per document, it boils down to taking about 30 FTEs.
Wow.
Situation, though, is that it's not 30 people that do this full time. It's 1,000 people. And it's this tiny percent of their job. So they don't have enough repetition to get good at it, right?
Interesting.
That 30 people or FTEs can be reduced about in half. So call it to 15 people with just workflow tools. It can be cut again in half through automation.
Interesting.
So you can get the 30 down to call it 6.
With higher precision, higher patient satisfaction because you're getting the information to the providers quicker, to the patient quicker, so all of those things as well.
Exactly. Downstream workflow improves cycle times. If you're getting things done quicker, revenue goes up, right? Downstream workflows happen faster.
Definitely.
Yeah.
Well, if you're just tuning in, you're listening to Healthcare IT Today with John, Lynn, and special guest host Scott Overholt. Sorry. And today we're talking about eliminating manual work. And I want to take a moment to thank our sponsor, Vine Medical. If your health system is overwhelmed by manual administrative tasks, I think that's all of you, Vine Medical Solutions can help by automating routine front-end processes like the capturing, managing, and exchanging of data. Their software integrates with your EMR system to automatically index data to the patient record. With Vine Medical, hospital teams can spend less time on mindless manual work and more time utilizing team members' unique strengths. The conversation today that we're talking about. Learn how Vine Medical's technology is reducing healthcare's manual tasks at Vine Medical. That's VYNEmedical.com. Well, Scott, we've talked about some automation, and I hinted at the idea of fax. And I think most people that hear about fax are like, why is it still there? Let me ask you, should the fax be dead in healthcare?
It's a really good question. It's a complicated question. when people think of fax, they think of someone walking up to a machine and running a piece of paper through it and dialing a number.
Ooh, that warm fax coming out that was heat generated.
Right.
Yeah, no, we have miserable memories of that. Yeah.
Right. Today is very different. A fax is an electronic exchange, if you will, or an exchange, let's put it that way, of electronic image. So when we're talking about faxes coming into the health system, they're typically coming in looking like a blurry PDF or a Word document. It comes in as an electronic image. The problem is there's no structure to it at all. It is not data.
That is a problem.
And in fact, you'll find this super interesting. There are situations like this is very common where one EMR does not talk to another one. And so they will take data and create an image and fax it over a phone line to the hospital that receives it as an image and has to turn it back into data. Imagine the inefficiency there where which we have done, we can create an electronic connection between the two. The fax goes away and the need to turn this back into data is eliminated. It stays data the whole time. Fax is a great way to send an image. It really is. Today's technology doesn't necessarily even have to rely on a phone line. Mm-hmm. If both ends of the connection are part of a network, it can go at, basically over IP.
Yeah. I think it's interesting because obviously you described nirvana, right? Two EHRs actually sharing data, and it's evolving and it's getting better, I think, and we're seeing improvement there. But when someone says, should fax be dead? I ask a couple things. First of all, do you think anyone would use fax if they had a better option? And the answer is no, right? If it was ubiquitous, so it's like, okay, well, why are they sticking with fax? Because there is a better option, but is it available with that health system? There's a lot of questions. Like you said, it's a lot more complicated than just get rid of fax.
Very complicated.
And the challenge I have also is like, okay, so let's acknowledge that everyone wants to get rid of fax and would be happy to never send a fax again. But why are they still sending it? And my comment to that is, wait, you want to get rid of fax, the most interoperable part of healthcare. And why is it interoperable? We know someone's fax number. Mm-hmm. We know the standard, and we can send it. Those two things are the biggest challenges of why fax still remains. And like you said, fax is not the old school fax showing up on the printer that's insecure, that anyone can see the information. It's being sent as a digital fax. So it is a digital transmission. But to your point, you're right. We are losing a lot of fidelity of the data that's being sent between systems.
Yeah, that's very true. It is interesting that they are still relying on fax like they do, and it is because of the complexity.
Yeah.
If you look at a health system's makeup, right, there are a lot of in-network and kind of, if you will, out-of-network providers that are feeding in, and they're not all connected on the same EMR, and the only similar way they have to communicate is fax.
Yeah, and they want to share the data with each other often. And I would add another layer, which is, okay, sure, if you're Epic to Epic, you can share some data, and they've worked to solve that. And we've seen huge improvements that way. QHINs are on their way with Tefka. We'll see how that evolves, right? There's secure direct messaging, which is solutions that share some data. Some would argue not enough data, not the right data, which, that's the beauty of fax. You could send whatever you want, like literally whatever, and you figure it out. But I think the other reason fax is so strong and probably won't go away, even if we solve kind of this interoperability problem between EHR, and that's all these auxiliary organizations, whether it's home care, whether it's long-term post-acute care, skilled nursing facilities, et cetera, labs, other things like that. They, many of these, especially post-acute care, don't have the money. They weren't incentivized. They didn't get any government money to implement the EHR. And so fax is the only way to communicate with them. So as much as we would love to get rid of fax, I think we all would, it's going to be around for a while.
It is going to be around for a while. I agree. In fact, we have one health system client, and they're basically processing 120 million pages of fax a year. If you think about the volume of that,
I can't
right?
even process that.
No, it's unreal. We've learned a lot too about the process of faxing and dealing with fax. It takes on average, for a complicated fax, there's lots of different kinds.
Sure.
There's orders, there's
spam
labs,
faxes too.
yeah, there's pharmacy, there's a slew of different fax. There's long-term care like you're talking about. On average, what we found through a study that we did with 24 health systems was it takes them an average of 5.1 minutes of manual effort per fax to process it.
Wow.
Right? So you start thinking about the study I shared with you, the numbers I shared before, we're assuming that number went to 3.5 minutes. So as it goes to 5.1 minutes, the cost goes up, the number of people required goes up, et cetera.
Sure. And I mean, I'm just 5 minutes to process a fax.
Yep.
And you think about, they probably are getting tired of it. I know I worked at a job where I was doing a lot of manual entry. And over time, you just kind of get lazy, right? Like, I think it's human nature.
Yeah.
And so I think, that's why it's, when I talk to people and they're like, what AI is really going? I actually love it when applied to fax, because when you apply it to a fax, you are reducing the manual labor for these people that don't want to do that work anyways.
Right.
And you're increasing the quality of the work that's being done. Because the bot doesn't get tired looking at an image. It doesn't get tired looking and saying, man, why is this on the right side versus the left? It says DOB. I know that's date of birth. I can classify that. And it does it, in a much more accurate way. It's not perfect, right? I mean, there's still error rates. But the problem, again, this is a classic AI discussion we've had on this, on our show a lot of times, which is, why are we comparing AI against perfection rather than AI against the current state of reality?
Yeah. I mean, do you have processes in your work that you dread?
Too many.
Too many, right? The reality of these documents, and it doesn't necessarily have to be a fax. It can be a PDF or whatever other electronic document or image comes in, is that it's a tiny percent of these folks' work. And it's the part that they,
that's interesting.
Dread, right? A lot of them are focused on providing care for patients, and that's their passion, and that's what drives them. And then all of a sudden they have to drop everything and transcribe from a document image over into another system, right?
Wow.
And because it's such a small component of what they do, they never really get great at it.
So what can be done to address this and improve the work with faxes, since they are going to be in the future? I mean, that number you shared, it's sticking around.
Yes, it is. In fact, we have seen it grow over the last few years. But I think, the solution is to provide automation first of all, it's workflow tools, but secondly, it's automation. So if you think about dealing with an electronic document, and let's say it's incomplete, or you have to redact something before you can move to the next step. If you have electronic tools to be able to request a signature and boom, send it right back, or redact this area and send it on to the next step, it helps a lot. You can, on average, you can take that 3.5 to 5 minutes down to just a minute or so, right? Just through the right technology tools. But the next step, the next level solution is automation. We can, by looking at an image, we can identify the document type. We can transcribe information from that document into data again. It can be indexed to the patient automatically with integration with EMR or other systems. It can automatically notify, based on the document type, the teams or individuals that need to receive it. And then the whole thing, the image and the data that's been extracted, can all be pushed automatically to the EMR or document management system or whatever the source of the record ultimately is. that part can be automated. So now you're taking this whopping 3 to 5 minute process down to just seconds. By the time it arrives at the user, 95% of the work, or 99, is done. It just requires a human to check it, maybe make a decision or two, and push a button.
And do it. That's interesting. I've always said that one of my favorite parts of my job and the most exciting things I see is where you see layers of technology and improvement that creates kind of a magical solution in many cases. And it's probably also why people aren't implementing it, is because you do need the OCR on the image.
Yep.
And then you need the NLP on top of that to be able to pull the data. And then you need it, of course, you need the digital fax, because if it comes in as paper, that's not going to work. You got to scan it. And then you need the integration with the EHR. And then I'm sure I'm missing some components here, right? But you can see each of these innovations that happened in the industry have enabled and opened the door for what feels like magical solution when you're like, wait, you already found the patient for me? Wow, you already identified the document type? Oh, this is a pharmacy requisition request or refill or whatever it might be. It's like, wow, so I think that's what's so cool, and probably is what many people are like, they can't see past the 6 layers of complexity in their own mind, so they think, oh, they probably can't do this.
Exactly, and there are a lot of use cases here. Like, if you start thinking outside the box, lockbox documents. So these are basically mail that comes in from payers, from banks. It's statements, it's bills, it's all kinds of those types of documents that basically go through a scanner and end up in a folder.
Wow.
People have to process those too a lot of times. And the good news about these kind of documents is that they can be, typically anyway, 100% automated.
Wow.
So you can take from that folder and run it through automation, and those documents go where they're supposed to go. In the systems, they get indexed to the patients correctly. Anybody that needs to be notified gets notified, and there's zero human effort there.
Amazing.
It's unbelievable amount of documents that have to be processed.
That's awesome. Scott, this was a lot of fun. I love having you as a co-host with me. I love having guest hosts on the show, so I appreciate you taking time. And thanks to all of you who tuned in to this episode of Healthcare IT Today. I want to thank Vine Medical for sponsoring today's episode. You can learn more about Vine Medical and their solutions built for healthcare at Vine Medical. That's VYNE medical.com. And find more details about our show by checking out the programs page on healthcarenowradio.com, and share your voice and engage with the community at healthcareittoday.com and on Twitter using the hashtag HITSM. I'm John Lynn with my special guest host, Scott Overholt. Thanks for listening, and have a great week.